Great. Thank you, Dr. Ryan. I'd like to next introduce Dr. Michael Van Dyke. Dr. Van Dyke is the Section Chief for Environmental Epidemiology and Occupational Health at the Colorado Department of Public Health and Environment. He is currently the Principal Investigator for Colorado's Occupational Health Surveillance Program and Colorado's Environmental Public Health Tracking Network. Dr. Van Dyke also manages the newly created Marijuana Health Effects Unit at the Colorado Department of Public Health and Environment that has been charged with developing surveillance methods for potential adverse effects of marijuana use. So welcome, Dr. Van Dyke.
Can you hear me?
Yes, we can. You can go ahead.
Oh, fantastic. Thank you. Thank you for the opportunity to speak today. I apologize I can't be there in person, but I can assure you that I have a face for radio, so this might be better. So just to give you some background, I am, since 2014, I've also been the chair of what we call our Retail Marijuana Public Health Advisory Committee. This is an external committee that's really charged in Colorado with doing a systematic literature review on the health effects of marijuana, as well as reviewing all the public health surveillance data around marijuana, and doing all of this in order to provide public health policy recommendations around legal marijuana in Colorado. So just to give you a kind of a perspective on marijuana in Colorado, I mean, I'm sure you guys are going to review some of the literature that's come from Colorado. I think it's really important to realize that the landscape has changed over a long period of time in Colorado. First of all, medical marijuana was legalized in 2001 in Colorado. And really, from 2001 till about 2010, this was really a small number of patients that used medical marijuana in Colorado. In 2010, that was when the federal government produced the Ogden Memorandum that really said that the federal government wasn't going to interfere in Colorado's plan. And at that point, there really became a commercial market for medical marijuana. So in 2010 is where we had retail dispensaries opening up. So you saw a huge increase in the availability of marijuana in 2010. In 2012, retail marijuana or recreational marijuana was legalized by the voters, and our retail marijuana stores opened in 2014. So the committee that I'm a chair of, we've been working on this process since 2014. And in 2015, we published a report that outlined our systematic literature review on the adverse effects of marijuana. Since 2015, we have continued to update and revise this document, and we think it's really one of the most comprehensive reviews of the public health consequences of marijuana use. And I really want to share that why this report was important for Colorado and how this report has been used, because I think that's much more important for this committee to hear. So this was a really important report for Colorado because it really laid a solid foundation for evidence-based prevention and education campaigns, as well as public health policy going forward. It would have been great if we would have published this report in 2012 and it would have guided the whole process. But at least it guides us in going forward and making changes. And from my perspective, the strength of this document was really the transparency of the methods and the effort put in to really translate these findings to a near plain language statement that were readable by the public. The document gave us, as a health department, the needed backup and documentation to defend our policies and our prevention campaign from both sides, both the pro-marijuana groups and the anti-marijuana groups. So it was really important to have this document. From a surveillance perspective, we've been monitoring changes in Colorado for 2.5 years now. And the things that we've been looking at are things like changes in hospitalization and emergency departments. So since legalization in 2014, and even prior to that, starting in about 2010, we have seen increases in child poisonings in Colorado that result in stays in the emergency room as well as the hospital. seem to be somewhat leveling off in more recent years, but they are still happening. We have also seen increases in overall hospitalizations and emergency department visits that have marijuana codes associated with those visits. What we're looking at is we're looking at billing data, and we're looking at ICD-9 and now ICD-10 codes. And just because these have a marijuana code, it doesn't mean it's the cause for that emergency department visit or hospitalization. But we use it to really monitor trends. And it's a little bit unclear why these increases are happening, because it's really multiple reasons. Some of it is changes in attitudes in Colorado. Users are more likely to report using marijuana when they go to the hospital. It might also be changes in clinician behavior. So we can't pin it all on more availability. But some of our other work, we've really focused on talking to emergency department physicians, and kind of the top concern they've seen in the emergency room are people coming in with cannabinoid hyperemesis. Kind of second on the list would be things like anxiety and agitation. And I mean, those would be the main things. In further analyses of our hospitalization and emergency department visit data, we've looked at the visits with a marijuana code compared to visits without a marijuana code. And when we do that comparison for hospitalization, we see about a 9-fold increase in visits related to mental illness that have a marijuana code as compared to not having a marijuana code. For ED visits, that same number is about a 5-fold increase. Now, we're not saying that marijuana is causing these visits, but I think it really pins us down to say that mental illness is a really important factor to look at as we're looking at this data. As with Washington, we've also looked at poison center data, and we've seen increases in calls to the poison center since 2010. It has leveled off more recently in 2015 and 2016, and the largest increases we saw were really in the time period from 2009 to 2010 when we saw the medical marijuana commercialization. Interestingly, we've seen increases in all age groups, but the largest age group increases in terms of calls to the poison center have really been in the 0 to 8 years old and the 25 years and older. The increases in the kind of adolescent range are much smaller. In addition, we also look at substance use patterns. So one of our main charges is really to say, are marijuana use patterns changing in Colorado? And I think we have really solid data in terms of adolescents provided by our survey called the Healthy Kids Colorado Survey. This is the Colorado version of the Youth Behavioral Risk Surveillance System that CDC does, and we've been doing this survey in Colorado for a number of years. In 2015, our current use among high school students was about, and that's use in the past 30 days, was about 21.7%, compared to the national average of 21.2%. This is in Colorado. This survey that we do, it's a large survey. It's a survey of about 15,000 students, so it's a relatively large sample size. And again, we have trend data over time that shows that marijuana use is fairly flat, at least for the last 3 or 4 years. Adult use in Colorado is a little trickier. We rely on our state-based survey, our Behavioral Risk Factor Surveillance Survey. We have some state-added questions on marijuana use, and unfortunately, we don't have a great baseline. In 2014 was the first year we had marijuana use questions on that survey, and of our adult population, about 13.6 report using marijuana in the past 30 days in 2014, compared to 13.4% in 2015. Now, if you look at the National Survey on Drug Use and Health, it does show kind of an increasing trend over time. So I think we may have missed the increase with not having that baseline data. In terms of really important issues for our committee, for our state, this committee needs to, we would really like to see addressed. I think I'm echoing what some of the other speakers have said. Effects on unborn offspring and those breastfeeding is really important to us. effects on adolescents, particularly mental health effects, really important issue. Long-term effects, particularly neurological and respiratory, have been mentioned a lot. I think it's critical to begin to start the discussion on, are there differences in health effects among occasional versus heavy users? And also thinking about acute effects for vulnerable subpopulations, people like those with existing or pre-existing heart disease. And I think kind of the million-dollar question for all the states is, and I'm not sure you can answer it or anybody can answer it right now, is what are the effects of the increasing potency levels of marijuana that we have in places like Colorado and Washington? And as you're going about this review, I would urge you to really come up with good definitions for regular, occasional, and heavy use that we can use across the country so we are comparing apples to apples. And then finally, I would say that this experience in being the chair of this committee has been very different. I mean, when you work in public health, you're not used to having really strong activist groups on both sides of an issue. There's not a really strong citizen pro-tobacco group, but there is a very strong citizen pro-marijuana group. So I would really urge you to make every effort to maintain a transparent process and to keep an unbiased tone as much as possible to maintain credibility. We've had some real issues from the public about the credibility of documents produced by places like the National Institute of Drug Abuse. And these have been public concerns, not our concerns. So with that, I also have interesting data to offer to the committee if they are interested. We are just now analyzing our adult use data for 2015. It will be released shortly. Some of that data that might be of interest are we now will have kind of the population-based data on the number of times per month people use, the number of times per day people use, and the method of use that people use, including things like tabbing. So with that, I will turn it over to the next person.